1 month ago today, Oregon Governor Kate Brown shut down all but emergency health care in Oregon. She wanted to stop the spread of the coronavirus and slow the use of personal protective gear for medical workers. It was suddenly in very short supply. Today, the governor announced conditions have changed and health care can open again on May 1st.
Thanks to each and every one of us who are doing our part to follow early and aggressive social distancing measures I put in place, Oregon is in a position where I can lift the executive order delaying non-urgent procedures for our hospitals, clinics, surgery centers, and dental offices.
The governor said it's clear that the state has now or is about to have enough personal protective gear for emergency workers fighting COVID-19, and that played in her decision. So too did the financial hammering that hospitals are taking from a lack of business, especially those in rural parts of the state. Just yesterday, the CEO of Lake Health District near the California border told me his hospital has lost $3 million in revenue. Big news from the governor today. What's your reaction?
I think it is marvelous information, a sign of thoughtful leadership after having a lot of input from the medical community.
It's marvelous in the big city, too.
The governor actually pleasantly surprised us with relaxing her executive order earlier than we had anticipated, but we're ready.
Governor Brown will require hospitals to keep 20% of their beds empty just in case there's a surge of COVID-19 patients, and businesses must have enough PPE to protect their employees and customers. Trent Green, the chief operating officer at Legacy Health, says the huge medical organization has all that and more. It has suffered through a 50% drop in revenue during the governor's order and canceled 1,800 procedures. Green expects things to start slowly.
I think there'll be some trepidation. We've got processes in place to ensure that they are safe and our staff are safe. So we're very aggressively monitoring our PPE consumption. We'll be testing every surgical patient before their surgery.
The order covers way more than hospitals. Physical therapists, optometrists, surgery centers, and others can all reopen. The list also includes your dentist, but not until they have enough PPE. Now, I'm aware that a lot of dentists voluntarily gave up their PPE for the medical world. So what's that mean now? Do you guys have enough to be able to open the offices?
That may be one thing that slows us down a little bit from getting back to full capacity.
It is a big first step back towards some version of normal, something that everyone, including the governor, is looking forward to.
I personally can say that I am very excited to schedule a dental cleaning appointment very, very soon.
Back live now in Northeast Portland, both the hospitals and the dentists say if you're wondering about your next appointment, you should call them. They're ready for you. And also, if you go to the dentist's office, don't be surprised if you find the waiting room is actually in your car to give you more room. Back to you.
All right, makes sense. Thanks, Pat.